you check on patient 3 already? No. Has anyone gotten them paperwork? Okay. Yeah, I can bring it in. Okay, thank you. Knock, knock. Hi there. How are you doing today? Good. Yeah, I'm doing well. Thank you for asking. Spring has officially sprung, huh? Yeah, all the birds are chirping. I honestly think we have a nest or something. I heard a baby earlier, a baby bird. Have you been to our clinic before? No? I just do want to warn you that we are very close to the airport, as I'm sure that you've seen, so we do get quite a lot of air traffic, but shouldn't be anything that interferes with your visit here today. Has anyone gotten you your intake paperwork yet? No, I didn't think so. Here, let me grab that for you just really quick. Alrighty. So, I am going to have you fill out both the front and the back side of this for me. And this is just really brief medical history. We are going to go over all of this in a little bit on my electronic system, but we do like to have a physical copy for our records just in case we have electronic failure or anything like that. I am going to leave you with this for a moment, and if you have any questions, feel free to just, pop your head out of the door and someone will come and grab me and I can help you and answer any questions that you may have. But for now, just fill this out to the best of your ability and I will check back with you in a few minutes, okay? Here is this. Oh! Here you go. Alright, so like I said, I'll just leave you with this for a couple minutes and then I will be back, okay? Yeah, let me know if you have any questions, but like I said, we're gonna go over all of this in a second, so I can help you in just a moment, okay? Alright, I'll see you in a second, alright? Thank you. How come no one told me that patient number 3 was so attractive? Yeah, come on, you guys know I'm single. Do you think I should ask them out? Yeah, you're right. Let's see what their exam comes up with, and then I'll make a decision based on that. Good idea. Oh my gosh, you are too funny. Okay, I'm gonna go check on them and see if they finished their intake. Hey, are you all done with that paperwork? Yeah, I can go ahead and take that from you. Thank you. And did you have the pen? Oh, okay, thank you. Alright, I am just going to set us up really quick. Like I said, some of these are going to be repeat questions from the intake form that you just filled out, but I'm just going to go ahead and take the answers from you again anyways. Just like to triple check, make sure everything is accurate. Okay, let me make sure I'm all set up here. So, to start, how do you spell your name? All right, perfect. And what is your date of birth? Perfect. All right, and were you referred to our clinic by anyone else, or did you just find us on your own? Yeah, that's fine. All right. And what did you say your reason for visiting today was? Just a general exam? Sure. That is fine. Perfect. And while we are here together, is there any other concerns that you needed addressed or anything like that? Okay. Yeah, that's no problem. All right. And whenever we have a first-time patient here, we always like to ask if you have any health goals or any achievements you would like to make. Okay. Very nice. Is that something you've wanted to do for a long time? Yeah. I'm sure that we could help you out with that. All right. And then how would you rate your health between excellent, good, fair, and poor? Okay. That's okay. No worries. All right. And then do you have a primary health provider? Physician or anyone? Okay. And are they just a general physician, or are they a specialty doctor or anything? Okay, sure. Alright. And are you currently taking any prescription medication? Sure. And do you know what the names of the medications you're taking are? And how many milligrams a day are you taking of that? Okay. And how many times a day are you dosed? Okay. And then what did you say the other medication was called? Okay. And how many milligrams of that are you prescribed? Okay. Good. And how many times a day do you take that one? Okay. Perfect. And do you have any known allergies to medications or just in general? And what are they? Okay, thank you. All right, so I am going to go through a very extensive list of previous medical history that you might have been affected by, and I would just like you to tell me yes or no. You could also nod or shake your head, thumbs up, thumbs down, whatever works for you. We're just going to start at the top and go in alphabetical order here. It's totally fine if you have had none of these or all of them. If you've had all of them, I would be slightly concerned for your health, but I'm sure you're in the right place if that's the case. All right, so any alcohol or drug abuse in the past? Okay. And what about allergies? I know you said it earlier. Okay, got it. And anemia? Okay. Anxiety? Okay. Rheumatoid arthritis? Sure. Osteoarthritis? Asthma? Okay. Any bladder or kidney issues? Okay. Any blood clots in the leg or in the lung? Anything like that? No? Okay. Any blood transfusions? Okay. Any types of cancer? Okay. Cataracts? Okay. Chickenpox? Okay, gotcha. Any coronary artery disease? Okay. Depression? Diabetes type 2? Okay. And type 1? All right. Any fractures or broken bones? Okay. Where did those happen? Sure. All right. Thank you very much. Have you had any gallbladder disease? Okay. And any glaucoma? Gout? Okay. And have you ever had a heart attack? Okay. Have you ever contracted hepatitis A, B, C, any of them? Okay. And do you ever struggle with high blood pressure? All right. What about high cholesterol? Okay. All right. Do you have any IBS symptoms? Okay. Have you ever had any kidney disease or kidney failure? Any kidney stones? All right. And have you ever had any liver disease? Okay. Any migraines? Sure. All right. Osteoporosis? Okay. Pneumonia? Any seizures or history of epilepsy? And any skin conditions like eczema, psoriasis, rosacea, etc.? Okay. Do you have any abnormal spots or moles that you're currently worried about? And have you ever experienced sleep apnea? What is it? It's basically when you stop breathing while you're asleep. It can be hard to know if you don't have another person that sleeps in the same room as you. It's no problem. Sure. All good. Any stomach ulcers? And have you ever had a stroke? Okay. Any thyroid issues of any kind? Hyperactive, underactive? Okay. Awesome. And then, is there anything else that I should know about your medical history? Okay, perfect. Have you ever had any surgeries? Okay. And when was that performed on you? Okay, sure. Gotcha. Are you adopted? Okay. And is there at this current time any family history that we should be aware of? Okay, that's fine. Gotcha. Okay. And do you have any history with tobacco usage? Okay. And did you ever? Okay. Do you have any exposure to secondhand smoke? Okay. And how about alcohol consumption? Sure. How many drinks would you say that you have a week? Okay, that's fine. And would you say you regularly drink beer, wine, or liquor? Okay. All right. Any recreational drug usage? Okay. All right. And are you an active duty military member? Okay. Sure. Are you exposed to any toxic chemicals in your workplace? Okay. How about during any hobbies that you may have? Sure. Are you on a special diet at all? Okay. Are you exercising regularly? All right. What kind of exercise are you doing? Okay. And for how long? Okay. And I think that is all of the questions that I have for right now. Is there anything else that you would like me to add in my notes? Anything I should be including in your file with all of this? Okay, sure. Okay, awesome. Perfect. Just gonna submit this really quick and we can move forward with your physical exam. Okay, looks good. Alright, awesome. I am just gonna go ahead and put a pair of gloves on to make sure that everything is nice and sanitary for us. I will be just checking all of your vitals and your reflexes, just making sure that all of you is working in tip-top shape. I'm also not sure if I mentioned this, but I am cross-training to be a dental hygienist. Our clinic is pretty small, so we needed someone to fill the position there as well. I do have some of my dental tools here, and I would be more than happy to give you a completely free comprehensive dental exam on top of your physical today if you're interested. Yeah, I just want to get some more practice and make sure that I feel really confident when I go and take my exam. It's actually next week, so you're going to be one of the last patients that I get to practice on. Yeah, just nice free teeth cleaning and make sure you don't have any cavities or anything. Should be really non-invasive. Okay, awesome. By the way, I'm not sure if this is out of line, but you have a really nice smile. Yeah, I know that these exams and checkups can be kind of serious, but let me know if there's anything I can do to make it more enjoyable for you, okay? Are you comfortable? Excellent. All right, let's see. Just gonna get my gloves on and then we'll go in here. Okay. So I'm just going to start by checking your eyesight. And then I am going to open up your mouth and take a look inside just with my hands. And then I will be testing your hearing today as well. And hopefully everything looks good. We will see. Awesome. All ready to go. I am just going to grab my flashlight here. And if you would do me a huge favor and focus on my hand for me. Good. Alright, I am just going to click this on and slowly move this into your vision. You can look away from my hand and towards the light, please. Good, excellent. Alrighty, moving over to this side, focusing back on my hand as I slowly bring the light in and looking at the light. Good. Gonna go ahead and bring it back over here. Good. And this side. Good. Everything's looking great with your eyesight. How are you feeling about everything? Have you noticed any vision loss or impairment recently? No? Okay, sounds good. Awesome. Alright. I'm just going to have you open up your mouth and I'm going to take a look inside. Okay, looks good. Very nice, very nice. Okay, good. Yeah, everything looks except there's one spot of plaque that I would love nothing more than to clean off for you and just a little bit here, but everything else looks pretty good. Okay, I'm gonna do some more eye tests. Can you focus on my finger for me? Good, and just follow it around. Good, and focus on this finger. Following it around and around. Good. This finger. And this finger. Excellent work, right? Your eyes are looking really good. I'm going to test your hearing now. I want you to listen to the sound of my hand. Good, following it over here. And back this way. And this side. Focus on my finger. Focus, focus, and switch. Focus on this finger, going closer, farther, closer, farther, and around, around, switching around, 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 closer, farther, boop, boop. Focusing, focus, focus, good. And the other side. How are you feeling about your hearing today? Good. Good. Both hands. Good. Alright, I'm going to play some resonating sounds for you, and I want you to see if you can hear them. Okay? I'm going to start with the lowest one. Okay? Good, and this side. Okay. Good. Can you hear this? In both ears? Alright, excellent. Gonna move to the next highest. Okay, starting on this side. Good, moving over here. Good. Alright, how did that one sound for you? Amazing. Alright, moving on. This is the highest tone that I have. focused on the sound. All right. Which tone did you like the best? The first, the second, or the third? Which one out of the three? Nice. Good to know. Alright. If you don't mind, I am going to have you lean back a little bit, and I am going to check inside of your mouth and just make sure everything is looking good. There was that one spot of plaque that I wanted to clean up for you, but other than that, everything is looking really great today, and I don't think that we'll need to do much. We'll just have to see about what's going on with your mouth, okay? So if you want to lean back for me. All right. Thank you for leaning back. I am just going to take this tool right here. Oh, maybe this end. We'll see. I'm not really quite sure. I think I might use this one. But I'm just going to take this tool and let me just triple check that there's the plaque I saw. Yeah, definitely looks like I thought it did. Okay, so I'm going to take this and I'm just going to scrape teeth. Use my little mirror to help me. Good. Just hold nice and still, please. Good. Still, please. Okay. Good. Looks a lot better already. Okay. Sure. You're doing a great job of holding still. Thank you so much. Alright. Brilliant. Everything looks really, really good. I did go ahead and scrape that plaque off there for you. Okay, very nice. Looks good. I'm gonna have you go ahead and sit up again, and we can do your discharge paperwork and all that good stuff, okay? Yeah. Alright, well, thank you so much for coming into our clinic today. I know you said that this was your first time visiting, and I hope that you enjoyed your time with us today. I will say you were a pretty easy breezy patient for me. I am going to prescribe you something for your mouth just to make sure that you're not going to have any pain in the future. So I'll be right back with your prescription, and then you should be totally good to get on out of here. Yep. Alright, just give me 1 minute and I'll be back, okay? Alright. Thank you so much for waiting. So I have a couple things for you here today. These are some pills that you can take, and you're just going to take one of these every 36 hours. They are extended release, so they will be working for quite some time in your system. Okay. So this is your first medication, and this is just a long-term pain relief. And then I have this one for you, which is a little syringe. Okay, you're just gonna open it up like this and stick this in here, pull it up, and you're gonna fill it right up until the number 2. Okay, right here, the number 2. Okay, and once this is all gone, you shouldn't need any more. This is a fast-acting pain reliever. So if you experience any more pain in your gums like you did today, you can use this for some pretty instant relief. Just gonna set that back in here for you. Okay. Do you have any other questions for me before we get your discharge paperwork done? What am I doing for dinner tonight? I mean, it's hardly even lunch. I haven't even taken my break yet. Well, I'm off in about 35 minutes. And if you wanted to stick around the area, I would maybe be interested in going to grab a bite to eat together during my lunch break. It's only a 45-minute break though, so we'll have to go somewhere nearby. Okay. Sure. Yeah, why not? You know, I actually was talking to my fellow nurses about how attractive I thought you were, but I didn't want to say anything because I'm a little shy when it comes to flirting with my patients. But since you did the honors, I will happily accept your invitation. Yeah, absolutely. I'm really glad you came in today. Alright, let me get you all of your stuff bagged up. I will see you in about 33 minutes for lunch. Okay. I'm feeling like a sandwich or something, just really light, but you can choose. It's up to you. Alright. The door is that way, on your left. Alright, I'll see you in a bit.